Hey everybody, thanks for joining. We're asking folks to put their name, where you currently live, and your favorite holiday meal in the chat. As we get started, we'll start right at 6:05. I'm loving all the pie. We all love desserts here.
I could have been someone. Well, so could anyone. You took my dreams from me when I first found you. I kept them with me, babe. I put them with my own. Trying to make it all alone. Build my dreams around you. The voice of the unworthy payday court. The bells are ringing out for Christmas Day.
All right, folks. If you're just joining us, feel free to put your name, where you live, and your favorite holiday meal. Get started here in just a minute to make sure everyone can join. All right. Well, it just turned 6:05. We have a lot of information ahead, so I want to get started right away. Welcome. My name is Anjani Morrow, and I am with South Carolina Appleseed Legal Justice Center. Thank you so much for making it to our Zoom regarding the changes to SNAP that occurred this year. I'm here with my colleagues, Sue Berkowitz and Misa Bailey, and I'll let Sue introduce herself and Misa introduce herself as well.
I'm Sue Berkowitz. I'm the founder and director of policy for South Carolina Appleseed Legal Justice Center, and thank you for being here.
Yeah, hi there. I'm Misa Bailey, and I'm the healthcare project manager, and I'll be moderating today, so just helping take questions, but happy to have you on.
Thank you both. Okay, let's get started on who South Carolina Appleseed is. We are a policy advocacy organization based here in Columbia, South Carolina, made up of a small team of program staff and attorneys. We partner with individuals and organizations, both statewide and nationally, to advance public policies that enhance the lives of low-income folks in South Carolina. Our focus areas include healthcare, education, housing, food insecurity, consumer issues, and the list goes on. Unlike traditional legal services that assist people one-on-one, our approach targets systems change. So what is systems change? That's addressing the root cause of issues by transforming policy, systems, and structures. We do not provide individual legal assistance. That's the responsibility of South Carolina Legal Services. And NISA is going to be able to drop the phone number and a website link for legal services if that's something that you are needing some one-on-one legal support. What we really do is focus on maximizing our impact through the courthouse, legislature, administrative agencies, doing community engagement and media outreach. We do this work in the legislature with state agencies and when all else falls through, impact litigation. So that's an overview of what South Carolina Appleseed is. And in today's presentation, we have an hour-long presentation. We're going to go over, do an overview of SNAP and work requirements and HR 1, the new requirements for able-bodied adults without dependents, which we will call ABOD, exemptions to this rule, and then additionally, the increased burden it will place on South Carolina to run SNAP, and then we'll talk about what's at stake and next steps. Okay. So, SNAP and HR 1. You'll hear HR 1 a lot. So on July 4th, 2025, the president signed HR 1, which we'd like to call the big, bad, horrible bill. It made sweeping changes to a lot of programs, especially SNAP, also previously known as food stamps, that will harm low-income households in South Carolina. The bill cuts over $187 billion from SNAP across the country over the next 10 years, and it extends work requirements for families with children under age 14 and puts more of SNAP costs on states. I'm going to pass it off to Sue to ground us in understanding what HR 1 is and does, and an overview of SNAP in South Carolina. Right.
Thanks, Anjani. And I'm going to try to explain how we got here. So HR 1 stands for the House of Representatives Bill 1. It was the first bill that they filed when they came in for the new session. It's really a major law passed by Congress and became enacted in July of 2025. It was known from the press and what Congress would call it as the OBBA. But what it did is it went through the reconciliation process. And that was important to know because normally for something to get through the U.S. Senate, there has to be 60 votes. When they go through what's called the reconciliation process, which has to do just with funding and can change some things, but it has to be primarily funding, they only need 50 votes in Congress, in the Senate, and therefore makes it much easier for these kinds of matters to go through. So the main point of HR 1 was to cut government spending, to pay for large tax cuts to the very wealthy, and for ICE enforcement. There was about $1 trillion that was cut from programs that I think are near and dear to many of us on this webinar today. To do this, they made two big changes, one to healthcare, and they made a big change to the SNAP program. About $187 billion worth of money is being cut from SNAP over the next 10 years. Can we go to the next one, Anjani? Okay. So SNAP provides low-income households with funds for food. It's put on to what is known as an electronic benefit transfer card, and it allows folks to go into grocery stores, hopefully farmers markets, places that accept this to purchase food, and people are found eligible if they have a low enough income, and that they get a certain amount of money depending on how many people are in their household and how much their income is. Households must be income eligible and primarily go through the certification or recertification process about every 6 months. So we can go to the next one.
Okay. That's a lot. So we wanted
Yeah.
to talk a little bit about what this means. So food is a human right, and SNAP helps family who could not afford nutritious food the opportunity to purchase it. And in turn, SNAP program provides economic opportunity for retailers like family-owned grocery stores, convenience stores, and farms. So about 68% of SNAP participants in South Carolina are in families with children. About 35% are in families with older adults or are disabled. And about 33% are in working families.
So the ABOD, which is able-bodied adults without dependents, is not a new program. It has actually been around since 1996. And what that says is if you are considered to be an able-bodied adult and at that time without dependents, you could only receive SNAP for 3 months during a 3-year period if you did not meet work requirements. Work requirements were defined as working, volunteering, or in a work or training program of at least 20 hours a week or 80 hours a month. Now, the reason we didn't really hear a lot about ABODs for probably close to 25 years is that if you lived in a county that had very high unemployment or a labor surplus, the county could be totally exempted from requiring people to be in the ABOD program. And during this time, South Carolina Appleseed worked really closely with DSS to make sure they understood how to figure out how many of their counties were actually fully exempt. And I don't think it surprises anybody who's on this webinar to know that most of our counties were actually exempt for the majority of this time. So a lot of people who are actually technically ABODs never had to worry about it because the county they lived in had so much unemployment, folks didn't have to participate in the ABOD program. Now, if you were found to be exempt, and we'll talk about what those exemptions are in a little bit, even if you were technically an ABOD, you would not have to participate. The ABOD program would not apply to you, and these limitations, these time limits, and that is exactly what it is, a time limit, would not apply to you. And that could often happen if you were found to be medically unable to work, or you were a caretaker of an adult, somebody who was disabled, or a senior who you needed to take care of, or if you had children in your home, you didn't even have to worry about being considered an ABOD. So Anjani, can we go to the next one? Thanks. So prior to HR 1 being enacted and signed by the administration in July of 2025, when it first was enacted, people could be an ABOD if they were between the ages of 18 and below the age of 50. So over 18 and below 50. Back in 2021, during the previous administration, in order to get the Inflation Reduction Act passed, which had a lot of really important things to help people, like the enhanced the enhanced tax credits, so people could participate in the Affordable Care Act. They increased the age limit. That was the negotiations. They increased the age limit to 52 and then to 54. So it was still people without children in their household who were subjected to the time limit, but they also exempted all veterans, all former foster youth, recognizing that people who were in foster care and were now adults didn't have their families to fall back on, and people experiencing homelessness. Now, chronic homelessness was always an exemption, but they increased it to say if you were living with someone and you were couch surfing, or you had to live with another family because you could not afford a home, you also would be considered exempt from ABOD. Could we go to the next one?
I just moved it over.
Okay. Um, so now it's people aged 18 to 64. We've really increased who has to work. And we do know from the pandemic and from the last time we had a recession, the people who are the last to be rehired are often people age 50 and over. And I want you to remember this because we're now saying it doesn't matter if you might be one of the last to be rehired. If you are up to age 64 without children, or if you have children in your household that are over age 14, then you are also subject to the time limit. And we know that 14-year-olds and 15-year-olds and 16-year-olds, they don't need to be supervised when they're home, right? They don't ever get in any kind of trouble. But these folks are now no longer exempt and are subject to the time limit. In addition, we got rid of the automatic exemption for veterans, former foster youth, and people experiencing homelessness are not automatically exempt unless you can show that you are chronically homeless. Can we go to the next one? So, who is exempt? I'm sorry. So, near the end of the day, if you're younger than age 18 or you're 65 or older, if you're pregnant, you're exempt. If you're taking care of a child under the age of 14, if you're taking care of someone who needs help taking care of themselves, and this can be a senior citizen or it can be an older adult who has disabilities and can't take care of themselves. If you're already working at least 30 hours a week and you're still eligible for SNAP, you would not be considered an ABOD. If you're already earning $217.50 a week or more per week, you would be exempt, and that's because you'd be making minimum wage, and that would be what minimum wage times 20 is. If you're receiving unemployment benefits or if you've applied for unemployment benefits and you are continuing to be eligible, you are considered exempt. If you're not working because of a physical or mental health reason, and that doesn't mean you've been declared disabled, and we'll talk about that in a little bit, or if you're going to school, college, or a training program, at least have time and already eligible for SNAP, because some college students are not eligible for SNAP unless they're also doing some kind of work support requirement within school. But that would also make you eligible, exempt and eligible to continue getting it, not under the time limit. If you're meeting the work rules for temporary assistance for needy family, which is known as family independence here in South Carolina, and unfortunately, there aren't that many adults participating, and it's mostly only children in that program. Or if you're participating in a drug and alcohol addiction program, the time limit does not apply to you as well. So we can go to the next one. So prior to HR 1, SNAP benefits were available to lawfully present non-citizens, asylees, refugees, parolees, battered non-citizens, trafficking victims, and others. Now non-citizen eligibility is limited to lawfully permanent residents, Cuban or Haitian entrants, or individuals who reside in the U.S. In accordance with COFA. Now, that doesn't mean that if somebody is a non-citizen, that their citizen family or household members are not eligible, but it does mean their income would be then attributed to the household, but the whole household would not be would not be ineligible for SNAP. The problem will be is if for folks who are non-citizens, and we know the fear that right now a lot of folks feel, they may not want to enroll in SNAP for themselves or their families, but we want to encourage families to do so if they've got eligible family members. Okay, Anjani, I'm going to hand it over to you.
Thank you, Sue. We know that these changes can be very complex. One of the reasons why we're having this presentation. We've also created a fact sheet that we can share out with everyone after this presentation as well. And then later in the presentation, we'll go over next steps as well. So we really want y'all to understand what this means at a larger scale. So 22,000 to 37,000 households could lose SNAP under this new rule. HR1 cuts about 187 billion from SNAP across the US. And how that affects our retailers is that it impacts more than 5,000 retail locations in South Carolina who currently accept SNAP. So before we move forward to the next part of our presentation that covers the burden created for states to administer and provide benefits to folks, we wanted to be able to take some questions from the chat. Since we have more than about 56 folks on the chat up in the Zoom, we'll have to read out some of the questions that you have and be able to answer them. If we can't get to everything today in this 1 hour webinar, we will be able to keep the questions that you have in the chat in order to answer those through an email after the presentation. So Misa, is there any questions in the chat? If anybody else has things that they'd like to share, since I'm screen sharing, I can't really see.
Yeah, so we only had the one question about whether these slides were going to be shared after the webinar.
Yes.
We can share them, but also the fact sheet will be able to go out. And I do want to mention that the money that's being cut from the SNAP program, the 187 million out of South Carolina, I'm sorry, 187 billion out of the entire SNAP program, that's going to be over a 10-year period. But we need to remember that South Carolina gets $1.4 billion every year of SNAP dollars. That's money that's going into our economy. That's money that's going to feed people in our state, and that's going to be cut by a substantial amount. And that's going to be cut either because people are going to lose their benefits because they were not prepared or did not understand how to comply with the ABOD program. And in addition, we're going to be losing people because of the draconian cuts to folks who are immigrants in our state. So we need to be prepared to be able to help ourselves, our neighbors, people we worship with, people who go to school with our kids, everyone, to understand how these cuts are going to happen, but how people can avoid them and they can stay on the program if they do things early on.
Okay, I got a couple of questions coming in, 3 questions. So the first one is asking, when you say exempt, do you mean exempt from being ABOD?
Yes, I'm sorry if that was not clear. Yes. So if you fit into any of those exceptions, that means you're exempt and you're not considered ABOD. So if you get a letter that says you've been identified as an ABOD at your recertification, and you know that you are caring for your elderly parent, and that there is no other way for your elderly parent or your disabled older child, or that you are pregnant, you need to let the Department of Social Services know right away so that they can find you exempt from being found to be an ABOD.
Okay. So another question we got is, how will that affect the food bank?
You're going to be busy because if people lose their SNAP benefits, more people are going to come to the food banks. And what we all know is for every every meal that the food banks can provide, SNAP actually provides 9 meals. Food banks are for exigent circumstances, for emergencies, and we don't need a government created emergency to make people to have to go to the food banks. So yes, it's going to impact you, but what the food banks can do is the food banks can make sure all of the people that come to them understand whether or not they are considered ABODs, and you can help them make sure they comply or get their exemption.
Thank you, Sue. So I'll
Sure.
probably do one more and then I think we're gonna move on and then if we have time, we'll follow up on the other ones before the end of the call. Anjani, does that
Great.
sound
Yeah,
good,
that would be
Sue?
great.
Okay.
Thank you, Lisa.
Yeah,
So
yeah.
the last one, what effect should we expect to see at the grocery stores?
That's a great question. I am most concerned about when this happens, that if too many people become ineligible, that people will not be able to go to the grocery stores and spend the money that they need to spend. As grocery stores bring in less income, that means they're not going to need as many people to work there. And so while the grocery stores will probably do okay, except maybe the small mom and pops, and it may impact the farmers market some too if there's fewer people that can use SNAP there. What's going to end up happening is the grocery stores are not going to have as many people shopping. And if their proceeds go down, that means they may not need as many people. So remember, for every dollar that of SNAP that is spent, it's $1.8 impact, meaning it turns around in the economy and helps create jobs, helps keep people employed, and helps to support communities.
And Sue, I think it would be fair to say that our grocery stores in our rural areas and areas that there are higher need would be the first to be impacted by this.
Absolutely. Places where we already know we're suffering from food deserts. That's a great point, Anjani. Thank you.
Well, thank you all so much. We're gonna move forward. And again, if there's time after our presentation, we'll be able to take questions. If not, we'll answer all your questions via email after the presentation. Okay, let me get my screen back up here. Okay, so in addition to those cuts that happened during HR 1, the cost of managing SNAP in South Carolina is going to change. So currently, the cost of managing SNAP is equally shared between the federal government and the state. So this is the administration cost, which means anything to run the program. So the people, the equipment, the technology, all of those things that takes to actually run the program. And that is split 50-50. Now, starting in October of 2026, the support from the federal government will decrease when it was traditionally 50%. So South Carolina will have to pay 75% of the cost. It's going to increase 25% to run this program. This is the cost of running the program, the administrative cost. There's a reason I'm emphasizing this, because there is an additional cost when it comes to the actual food purchase, so the actual benefits. So again, the federal government has always paid 100% of the food purchase costs of those that are on SNAP. And I talked about starting October 2026, the admin cost changes. Now, October 2027, states would be required to pay up to 15% of benefits, depending on the error rate. It's really important to share what is this error rate. So the error rate is it's a rate that every state has on how well they are able to administer the SNAP program. And with these changes, the higher the error rate you have, the higher the cost the state will have to put up to be able to fund the benefits of the program. And it's typically an honest mistake finding a household eligible or an ineligible or an overpayment or underpayment of SNAP. The error rate could be done by the household when it comes to sharing the information, or done by the agency. Now, all of this, the ABOD things went into effect November 1st. So the folks that may or may not know that these changes have happened, but are receiving benefits, would also be affected by this error rate. So it's very diabolical how the government is going about this, because it increased costs for the state to be able to provide these benefits to folks. So only 6 states in the country have a low enough error rate that they will not be required to pay for benefits. South Carolina is not one of those states. We have a higher error rate. And if a state cannot or will not pay its share, all SNAP benefits will be cut in the state. So SNAP is kind of an all or nothing program. You need to be able to administer it along with that, provide all the benefits for folks that are eligible. So, quiz time. How did this happen? So we want y'all to put your answer in the chat. We have 7 U.S. representatives and 2 senators for South Carolina in our congressional delegation. So that means there are 9 people that represent us at D.C. How many voted in favor of H.R. 1? So how many people voted in favor of these changes? And I'll give you some time to think about it. Some of y'all might know straight off the top of your head. The news is everywhere. Okay. Who said 8? So 8 out of our 9 members of our congressional delegation, who we have sent to the Capitol from South Carolina, voted in favor of this. And I'm going to read off who those votes were. So we have Representative Nancy Mace, Representative Joe Wilson, Representative Biggs, Timmons, Norman, and Fry, and then our 2 senators additionally. So Senator Lindsey Graham and Senator Tim Scott. We had 1 no, and that was from Representative Jim Clyburn. So think about that on who did this. And in review, the effects of passing H.R. 1 are that we're estimating 22,000 to 37,000 South Carolina households could lose SNAP. South Carolina and the DSS is going to have to come up with, to fund DSS, is going to have to come up with around $10 to $20 million in this year's budget to administer SNAP. If the error rate is not lowered, South Carolina will have to come up with more than $210 million in next year's budget to both administer SNAP and now also provide benefits. Before passing it on to Sue, if there's anything you'd like to add here, and then we'll talk about next steps.
I would just say, I just wanted to add that this is a real shift with both this program and some shift with healthcare as well, from the federal government to the states. SNAP has always been 100% federally funded. It is something that has always allowed the states to participate. And so it's going to be really important that, one, that the agency does the best they can to try to get that error rate down, but get it down without purging people from the program, so that the honest mistakes don't result in people just going hungry. And also, it's going to result in the state having to do a lot more work because if people are going to be going through the ABOD program, those programs don't come for free. So it's going to, what we have to all be vigilant, both for those of us who receive SNAP and those of us who work with folks who get SNAP, is to make sure folks are not purged from the program.
Thanks, Sue. And I'll pass it on to you about next steps.
Okay. So what we want to do is make sure that everybody on this webinar understands so they can help either themselves or their friends or their family or people that you work with, that what you can do to help yourself if it's determined or you get a notice that says you've been identified as an ABOD. If you think it's a possibility, be prepared, because you want to make sure that you can keep as much of the resources in your household to purchase food, because we all know what our grocery bills are looking like now, and it's more expensive now than ever to make ends meet. If you're caring for an adult or a child full time, get the documentation to show you're unable to comply with ABOD and that you should be exempt. So, for example, if you have a parent that you're caring for or a disabled adult that you're caring for, then get a note from their doctor, get a note from their social worker, get a note from their nurse or from somebody else that has personal knowledge that you are doing this, that you're caring for the person, so that you can be found to be exempt from the requirement. If you have a medical reason that you can't comply, and it doesn't mean that you've been declared disabled, because we all know how hard it is to get declared disabled and how long it can possibly take to go through the Social Security system, either for SSI or Social Security disability. You can get a signed statement from your doctor, from your nurse, from your physician's assistant, from your nurse practitioner, or from your social worker or your therapist saying that you can't comply with the ABOD rules and that because of a medical reason you are exempt, and DSS will accept that. If you are living in a homeless shelter, if you are unfortunately living on the street, let DSS know. That can be a reason for you to be exempt, because even though they constricted the definition of homelessness, chronic homelessness, meaning living on the street or in a temporary shelter, could still keep you eligible to get your SNAP benefits. Reach out to DSS if you need help to meet the new rules or to show you're exempt. Or if you're going to the food bank, talk to them to see if they can help you to comply with the rules. Or if you're working with another nonprofit that is helping you with the issues that you're experiencing, then get them to help you make sure that you can comply. And to also, if at first you are found to not be exempt and you might be able to now comply, get the information to DSS to show any of those changes, to show how you may be exempt or that you're actually doing what they need you to do, so that if you do that for 30 days, you can then be back on the program. If after you lose your benefits and you now have that signed statement that shows you cannot comply, go back to DSS, show that to them, see if they'll reinstate you, or at the very least, have them now have you reapply so you can get those benefits. And if you think that you've shown them everything and that you've been wrongfully labeled ABOD, you can ask for a fair hearing. Anytime you're denied for SNAP, you have up to 90 days to ask for a fair hearing. Now, if you do this within the first 10 days from the date of denial, you can continue receiving those benefits if you're already getting them. But if you lose that fair hearing, you may be asked to pay them back. But you can always ask for that to get those benefits continued within the first 10 days. Okay. So we are on next steps.
We just finished those next steps, and I put in here your bonus slide, Sue, because we've had some
Thank
new
you. I'm sorry.
information.
I'm not the best at technology, and
Oh,
I work
you're
with
fine.
wonderful
You're
people
fine.
who accept me for this. This is a bonus slide. And I want to let everybody know, you may have seen in the news that South Carolina has recently received a waiver to put restrictions on what you can purchase with SNAP. It doesn't go into effect immediately, but after August 2026, you can no longer purchase sugary drinks, energy drinks, or candy with SNAP. Do we agree with this? Absolutely not. We don't think there should ever be restrictions because we know and believe that people who are living on SNAP and have used SNAP for their nutritional needs are probably much more responsible about how they're feeding themselves than I am, and I'm not on SNAP. DSS is telling the grocery stores exactly what this means. They're going to be educating the grocery stores what SNAP benefits can be used for and what they can't be. But stores are going to have to pay to program their EBT, their point of sale machines themselves. DSS can't pay for it, and the federal government is not willing to pay for it. So for smaller stores, that may be an expense they cannot absorb, especially in the rural areas where you have mom and pop stores or you have farmers markets where they're doing it themselves. If they cannot absorb that expense, they may have to make the decision not to accept SNAP anymore or take the chance of accepting SNAP benefits and guessing whether or not folks are purchasing something that actually complies or doesn't comply. We're hoping that eventually we can convince the state of South Carolina that folks on SNAP know how to responsibly purchase food for themselves and in fact make their food purchases, with the little bit of resources they have, last longer than so many people, that they don't act irresponsibly. But at this point, this is what DSS is doing, and maybe under another administration, this will eventually change. Okay. And with this, you need to protect yourselves. And how do you do that? I know it's really hard when you get certain mail that comes in, or you get a text from DSS and you get letters. You often don't even want to look at it because there's so many other things that are going on. But it's really important during this time of change not to ignore letters from DSS because it'll be important information that could impact you if you've been identified as an ABOD. If you're being told that you are potentially an ABOD, or if you think you may potentially be an ABOD, reach out to DSS immediately if you think they're wrong and get them and give them the information they need so that you don't have to worry about that. The determination for ABOD is going to either happen when somebody applies, if they're not on SNAP right now, or at the next certification. So you have time, if you're on SNAP, to reach out and to find out what's going on, whether or not they're determining you to be an ABOD, so you can get all of that information put together and avoid all of this and provide DSS the information that you need. And if you're applying for SNAP, or you know someone who's applying for SNAP, you now know what they can do to avoid being declared an ABOD or to be found to be exempt. And so there's things that can be done at this point now.
Right, this is our last slide. about next steps around advocacy. And I will ask Sue to talk about those first two bullet points, and I will leave y'all with ways to get involved with Appleseed.
So you're going to be given an opportunity to reach out to our congressional delegation because right now, as you know, government will shut down. We all know what everybody went through with SNAP when the government shut down, but it was shut down because they couldn't pass a budget. What they did do is pass a continuing resolution. Now, the good news is the continuing resolution says SNAP benefits are going to be paid through the next budget cycle. So that'll be October 2026. But the budget resolution does expire on January 30th of next year. And during that time, we're going to be sending out information along with a lot of our national partners about we need to tell Congress to get rid of many of the measures that they put into practice through the reconciliation process. And they need to put the resources back into SNAP and not to shift all of that to the state of South Carolina. We are going to have action alerts on our website, and if and Anjani will explain to you how to stay in touch with us. So, and with all the information you need to reach out to our congressional delegation, because the one thing we want to make sure that they all can't say back to us is, "Well, I didn't hear from anybody." It didn't matter. We know it matters, and we know that everybody that who cares about this will speak up. In addition, be prepared to advocate to our state legislature to make sure feeding people is priority, because we want to make sure if that 75-25 match for admin costs does not go away, that our state representatives, and those are the people who go to Columbia, both in the Senate and the House, all understand that we need them to fully fund the state agency so that they can, one, have the money to administer the SNAP program, and two, have the money to avoid error rates so they have the staffing that they need so that we don't have to worry about South Carolina having to come up with all of that additional money. And once again, we will provide that information to you and give you suggest things to be able to say and help you understand who you need to reach out to. Now I'm going to turn it back to Anjani.
Thank you so much, Sue. We want to ask how you would want to be involved in our work at Appleseed. So after this meeting, you will get several things from us. You will get the presentation, the recording, the fact sheet that goes over all of the things around the ABOD requirements and the exemption, and next steps on how to protect yourself. Additionally, we'll be sending out a survey, and I promise it won't take too long for you all to fill out, but it would be very helpful for us to understand what are ways in which we can involve y'all in the advocacy work, whether it goes from trainings, understanding who your legislators are, coming together and sending these letters to our legislators, and ways to advocate for ourselves. So please stay tuned for all of those things. And again, if you have the time, familiarize yourself with who your representatives are, both at the federal level and within the state, because that's going to be very important moving forward in this next year in order to be able to share and put pressure on the folks that we have sent to both capitals to represent us. And with that, thank you all so much for joining on this Monday evening during Hanukkah, right before Christmas, right before the end of the year. We really appreciate you all joining. These are both of our emails. So if you have any additional questions, feel free to reach out to us. And like I said, we'll also be reaching out to you. with all of this information. Seeing that we have 9 minutes, I'm going to pass it back over to Misa. If you can share with us some of the questions that are in the chat, and we'll answer the questions until it goes to 7 o'clock so we can be mindful of everyone's time.
Okay. So, one of the questions we got was, is physical disability self-declared?
You can self-declare, but if you have a medical provider, and it doesn't have to be a doctor, it can be a nurse, it can be a PA, it can, if you've got somebody who can help you with verifying, you always can self-declare. But if you have the way to get someone to help you verify that, it's always really helpful.
And an additional thing that was shared to us by DSS is if you are unhoused and you work with a social worker at a library, they can also send an email to share whether you are mentally or physically fit under the ABOD exemption. So they can send an email to DSS to declare your exemption.
Yeah,
All
so
right.
don't feel that you've got to go see a doctor to be found disabled. It really is if you have a medical condition that keeps you from working, whether it is for mental health, it could be substance abuse disorder, it could be some physical challenges that you have that are keeping you from being able to fully comply with this. You can use those as ways to find yourself to be exempt. Now, also remember, you can also volunteer at a nonprofit and try to help, but I can't imagine that all the nonprofits in South Carolina have that many positions that are available, but you can also check to see if you have a nonprofit, or there may be government programs that you can volunteer at that also, if you do those 20 hours, that would help you to comply.
There's also a question about what's the estimated time frame for the cuts to start. I mean,
It started November 1st.
They started. That
Yeah.
got passed in July.
Yep. And the ABOD requirement started November 1st, right? Okay.
Yeah, that's why it's important that when Congress comes back in January, we demand that they put money back into the SNAP program and undo all of these cuts as much as possible. And that's where your voice is going to be critical.
Okay. So there was also a question about, didn't you say the state participation is going from 50% to 75%? I saw a slide that said federal government hasn't always paid 100%. Is the 100% concerning administration of SNAP?
So the administrative costs were traditionally shared 50-50. So the federal government did 50%, we did 50%, and that is just covering the cost of running the program. And that changes next year to states doing 75% of the administrative costs, and the federal government will only provide 25%. In October 2027, the actual money for benefits, so there's admin costs and the cost for the food. In October 2027, the cost for food, traditionally, the federal government covers 100% of benefits. So it will change according to the error rate in South Carolina, how much will be covered. So you will see the cost of the admin costs going up along with the paying a portion of the benefits in 2027.
And that is going to be a much bigger cost, the actual benefit amount, because 15% of $1.4 billion is just a whole lot of millions. And even if it's only 6%, it's still a lot of millions. And so it's going to be really important that DSS gets the is able to get the caseworkers that they need and all the admin money that they need, so that they, the error rates there, it's not because people are committing fraud. It's not because DSS is not doing their job. They don't have a huge number of caseworkers. They probably haven't gotten money for new SNAP caseworkers. Maybe I'm guessing, but it could even be a decade. And so we need to advocate for those resources to go to DSS, because if they don't have it, that really puts them even in a much greater risk of committing errors, not because they're not trying, but because they don't have the staff to do this. And so we can be advocates for ourselves and advocates for those who are on SNAP, but we also want to advocate for the agency to get the resources that they need.
All right. And there was also another question. Homeless population struggles with purchasing items on SNAP already because they restrict prepared foods. Is this something that can be added to the argument?
Yeah, I think whatever you're comfortable with inputting into the argument to help our legislators and folks in Congress understand is always helpful. Anjani, your thoughts?
Yeah, I know just this last year, there was one state that did ask for a waiver for SNAP funding, for benefits to go to prepared food. I used to live in that state and it was years of advocacy, I will say that. But it's something that we've heard a lot that is really helpful for folks. So right now, yeah, add what you think needs to be added to put pressure on our legislators. I agree with Sue on that.
All right.
And I think we have time for one more question.
Yeah, there were so there's last one. There were comments made by the federal government suggesting that all SNAP recipients would have to totally reapply from scratch. Are y'all aware whether that is actually going to happen?
I have not heard that at all. People are going to have to certify, and maybe that's where somebody there's all new people at FNS who didn't quite understand it, was saying it, but people are going to have to recertify and may have to prove some new things because of some of the new rules. But no, it is not that everybody on SNAP, the 550,000 people on SNAP are not going to all have to just reapply.
And I see a comment under that question that I'd love to end with is Samantha wrote, I work at a food pantry and we are able to register people for SNAP with SC Thrive. We have seen a lot of people that did not have their SNAP get restarted in November and they have to reapply. They may be ABOD and never knew it.
If that is true, and I'm hoping, Samantha, you're trying to find out from folks, or you could go back to them and try to understand their circumstances, or send them back to SC Thrive, who I would think could help them with that, is to find out if they did not get their notice, their letter telling them that they've been identified as ABOD. If they did not ever get that and didn't have it, or get their notice of recertification, I think that could go to their error rate. So if you could investigate that some more and reach back out to us, that would be really helpful. Could we ask that of you, Samantha?
Thank you for that, Sue. And that was really one of and Samantha said that she can try.
Okay.
Yeah. And that was one of the biggest reasons why we wanted to share this presentation with everybody, because these changes happened just in the last couple of months with a lot of uncertainty around how this messaging has been given to folks. And we've been working with DSS to really understand what the impacts look like, and then additionally ways that we can start advocating to our legislators to protect SNAP and ensure that people are food secure across our state. So thank you again for joining. Thank you to my colleagues, Sue and Misa. You will be getting an email from us after this presentation about next steps, resources, and all of the information that was shared here. So I wish you all well. Reach out if you have any additional questions. Thank you.